Who interprets the results of a tuberculin skin test? Have you ever wondered who actually interprets the results of a tuberculin skin test, often called the Mantoux test? This important task is carried out by trained healthcare professionals. Typically, these are clinicians such as doctors, nurses, or other qualified medical personnel. Their role is crucial because they are responsible for reading the test results accurately. When a person receives a tuberculin skin test, a small amount of tuberculin is injected under the skin. After about 48 to 72 hours, the healthcare provider will check the injection site. They look for a raised, hardened area known as induration. The size of this induration is measured in millimeters. Interpreting the results is not just about checking if there is a bump or not. Healthcare providers consider several factors to determine if the test is positive, negative, or indeterminate. These factors include the individual's risk of tuberculosis infection, their history of Bacillus calmette-guerin vaccination, immune status, and any potential exposure to tuberculosis. For instance, a smaller induration may be considered a positive result in someone at high risk, like immunocompromised patients or those who have been in close contact with tuberculosis cases. In contrast, a larger induration is necessary to classify the test as positive in individuals who are at low risk. This interpretation requires clinical judgment and a good understanding of the patient's medical history and risk factors. If the test result is positive, further evaluation is necessary to distinguish between latent tuberculosis infection and active tuberculosis disease. In specialized settings, such as veterinary medicine or research involving non-human primates, trained veterinarians or researchers interpret the results differently. They may observe clinical signs, such as swelling or drooping of the eyelids, along with the test reaction to assess infection status. In summary, the interpretation of a tuberculin skin test is a task for qualified healthcare professionals. Their expertise ensures that the skin reaction is measured and evaluated in the context of the patient's unique medical history and risk factors. This process is vital for accurate diagnosis and appropriate follow-up care for tuberculosis infection or disease. Always consult with a healthcare professional for personalized advice regarding tuberculosis testing and interpretation.